Yeah, and I would say probably even though kids can be exposed to sort of having concussions, we probably a lot of our concussion patients are adults. And if we look at eye teaming issues and binocular vision issues and binocular vision dysfunctions, a term that's actually gaining some sort of presence. More and more people are sort of hearing about binocular visual dysfunction, and you can have. I'll break it down into sort of loosely three ways that you can have a binocular visual dysfunction. You either developed it when you were young because you didn't learn how to use the visual system properly to begin with. And the second one is that you developed one by over time through stress on the visual system, and that's doing lots of near work. And quite often adults I see with a binocular visual dysfunction or eye teaming issue have had that problem since primary school. And you'll ask some adults and say, did you always find reading a bit of a struggle? And they kind of go, yes, why did you ask that question? And it was like, well, you've got this eye teaming issue that I can tell you've probably had for decades and probably had it in school. And so they've shaped their life around what they can and can't do because of this binocular vision problem. And often it'll pop up again. So someone who might work with their hands gets into a management position where now they're doing a lot more office work, and here comes this problem where they're having trouble concentrating and they're getting headaches and eye strain, and they think it's the computer when in fact it was an underlying vision problem they've had sitting there their entire life, and they've just perhaps avoided some of the activities that trigger the symptoms. And then you have eye teaming issues that come from injuries, brain injury and concussions thankfully getting a lot more a sort of common awareness around, and we certainly see it in sport. I mean, we're seeing 20-something-year-old athletes getting their AFL and rugby league careers cut short because of multiple concussions. And if you look at the stats, you sort of at least 50% of people who get what we call a post-concussion syndrome, and that's where you are still having concussion symptoms past the recovery time, 2 weeks for adults, 4 weeks for children. And so 50% of those people with PCS or post-concussion syndrome have vision problems. And typically the kind of vision problems that you need to test eye teaming, focusing and tracking in order to pick them up and then therefore have the means to treat them through lenses and vision therapy. And that's when we get into terms like neuro-optometric rehabilitation. So, that's a particular type of vision therapy when we're talking about concussions and other forms of brain injury where it's presumed you had good visual function before the incident, and now we're doing rehab to try and restore as much function as we can afterwards.
So this could be something that affects maybe older people who've had falls, for example. That's a common type of occurrence. So people who maybe they've had that kind of incident and are now they might feel that they're feeling dizzy, or maybe their just general confidence is not up to what it was before. That could be a functional vision problem. Is that right?
Yeah, look, you get sensitivity to movement in your peripheral vision. You might become sensitive to lights and patterns. You start, and this is the challenge with concussions, is that you have a concussion, it puts you at a higher risk of having another one, because your balance and your ability to judge space and also your cognitive processing can be affected. And so you're at high risk of having another concussion, which is why when athletes have concussions, they take them off the field, and sometimes for weeks, because they want to make sure they're not put in a position where they're at high risk of getting another one. But it can be an innocuous thing. So in the sort of later decades in life, when we're at higher risk of having cardiovascular incidents, so stroke being one of them, you can have your vision impacted by a stroke. If we're talking more concussion injury, obviously that's a knock to the head. There are obvious things like having a car accident or tripping over and hitting your head heavily, but it can sometimes be caused by the most innocuous things. A tissue box falling out of the cupboard on your head and just hitting your head the wrong way. We've seen concussions from people attending to their push bike, and the handle hits them in the head when it tips over, and they get this relatively severe symptoms and consequences from what looks like a relatively mild event. And then you see players and athletes getting these massive big belts during the game, and then there's no concussion. And so we've got to stop tying the severity of what the accident looks like with the severity of the symptoms. Sometimes it can be actually quite a small thing. And so if you've had a small accident and you don't feel like you're seeing as well, or using your vision as well, or balancing as well, or judging space as well from even just a small accident, then you need to be thinking that there's some sort of post-concussion syndrome involved.